Hi, and welcome to this episode of Strategic Solutions TV. My name is Carol Bell, and today we will be discussing a really important topic for a lot of people, and that is how do you find a really good dentist when you're looking for one online, especially a good holistic or biological dentist. And today we have someone special with us to help us with this. Doctor, you know what, for some reason, I'm going to start over.
Okay.
I got this big, it probably would have been okay, but this big thing popped up in front of my screen. I thought, uh-oh, it may film that. Okay, let me just get going again. I can trim the beginning of that off. Hi, and welcome to this episode of Strategic Solutions TV. My name is Carol Bell, and today we will be discussing the topic, how to find a really good holistic dentist, especially when you're looking for one online. And we have a special guest who is going to help us with this topic, Dr. John Palmer from Palmer Distinctive Dentistry in Greenville, South Carolina. Dr. Palmer, welcome to our program today. How are you?
Thank you, Carol. I'm glad to be here.
Great. So, Dr. Palmer, a lot of people, especially in the Greenville area, go online every month looking for a good dentist. And a lot of them are looking for a holistic or biological dentist, and they don't always know what things they should be looking for so that they can find a good one. So as someone who has been in this business for a lot of years, you're truly an expert. What advice would you give someone today as to the things that are important for them to look for when they are looking for a good holistic dentist?
Well, Carol, there's basically three kinds of dentists today. They're the dentists that use the old silver fillings, they put them in that contain mercury. They're the group of dentists that kind of say they're mercury-free or metal-free, and they don't place those silver fillings that have mercury, but they may not protect the patient when they take them out. And then there's the dentist that refuses to place the silver mercury fillings, and when they do take them out, they take a lot of precautions in protecting the patient. And those are your holistic biological dentists. Now, they're likely to be members of three different organizations, the IAOMT, which is the International Academy of Oral Medicine and Toxicology, which I'm a fellow in that academy, the IABDM, which is an international biological, let's see, I get confused over all these initials. There's many patients. So I have to look back here at my plaque. It's the International Academy of Biological Medicine and Dentistry.
Okay.
And then the HDA, which is a Holistic Dental Association. And people who are in those groups are more than likely going to be the dentists that take precautions in their patients when they're removing mercury fillings, or fillings that contain mercury from them.
So it's good to know those distinctions, and obviously someone they would know what they're looking for, so that would give them a good place to start. So are there certain things that, say they're looking for one who is truly holistic or biological, what kinds of things should they look for, maybe on the website, or to maybe ask the dentist to be sure that they are a true holistic dentist?
I think the most important thing is that they would follow the protection protocols outlined by the International Academy of Oral Medicine and Toxicology. I actually teach those techniques twice a year at our meetings to our new members. A lot of them may have reference to that or links on their website so that you can find that, but probably you may just have to call and ask. And I think really important is the dentist protecting himself and the staff, his teammates. They'll be wearing at least some kind of respirator mask when they're removing these fillings. If he's protecting himself, then I know he's going to be protecting his patients.
Right. So probably one way they could start would be to check the dentist's website to see if he has reference to being a member of one of those organizations too.
That would be a good place to start. And
Okay.
if you go to my website, you'll actually see a little video that shows our patient protection protocols on it.
Oh, that's great. Okay, so that's good information to know. So if someone comes to see you in your office, what kind of experience can they expect to have with you, and what do you think makes your practice unique and different from the other dentists in the Greenville area?
Besides being holistic and taking all these extra precautions, you're going to find, one of the friendliest staffs available. My team members care about our patients. But what you're really going to find is how it would differ is that first appointment, which is often a no-charge consultation appointment. We're going to spend as much time as it takes to listen to that patient, to find out their concerns, what their other healthcare practitioners have told them, to try to help them connect the dots for what's wrong with them. Many of our patients are sick. The medical profession's kind of not listened to them enough to find out what's wrong with them, or they're being referred from medical practitioners we work with. And our desire is to help them get well by helping them have healthier mouths. And we take time to listen and find out how they want to do that. They participate in their treatment plans. We give them options, and we don't proceed until we know that they're happy with what they're going to be doing. Great.
Now, did you start out as a typical dentist and then transition to holistic?
I started out as a typical dentist. I believe mercury fillings were as safe as they could be. I worked with them for years. My wife worked with me chairside for a couple of years. And the way we changed our beliefs because both of us got mercury poisoning working chairside in dentistry. She got sick first, and then I got sick, and we had to find people. I've been through the same struggles my patients have. Something was wrong. Mainstream medicine didn't want to listen to me. I was lucky enough to find a local MD who diagnosed my wife and then got me in the office and diagnosed me with mercury poisoning. And that was where my journey began.
Wow, that's really interesting. So I know that you have an offer that you give new patients when they come in. Can you tell us about that?
Yes, we always give a no-fee consultation appointment, no matter how long it takes. If we have to have X-rays that day or radiographs, we're perfectly happy to go ahead and get those at no charge also.
Okay. So I imagine that you have people that come. Do you have people come to you from further away than just the Greenville and local area to you?
We have patients that come from a couple of states away.
Okay.
We've had people come from the Caribbean. I think the longest place in the States is from California that come to us.
Wow.
It's quite an honor when somebody travels and comes to us, versus all the different dentists they could stop and see.
Absolutely.
We appreciate it.
Absolutely. So, and the reason I brought that up is because I was going to say for all of you in the Greenville area, but really it's anywhere in the United States or within traveling distance of you, that I highly encourage to call Dr. Palmer and to set up a consultation, go in and see him and talk to him about what you've got going on, because he is a great, great dentist and has a lot of experience, a lot of years, and of course the illness that he experienced, which was the incentive to transition over to holistic. So he, like you said, he knows what his patients have been through, and it's such a more helpful way to practice. And so I really appreciate that about what you do.
Thank you, Carol. Thank you for all the kind words. Appreciate it.
You're welcome. And thank you for taking the time to share your expertise and your great knowledge with us today. We really appreciate that as well.
Thanks.
So thank you, everyone, for watching. We'll see you next time. Have a great day.